Well, Dr. Jackson, I want to talk to you about gum disease. And here's something I want to ask you, okay? And I really need a candid answer. Just about every dentist, when he talks about gum disease, he will say, if you don't fix it, you will lose your teeth, and that's very, very bad. And while I agree that this is very bad, here's one thing. At the very least, you dentists do a phenomenal job replacing teeth. We have crowns and bridges, which we had for a long time. We have partial dentures and full dentures, and we have, of course, the state of the art since the last 10-some years and getting better and better, which is implants. Now, it's not like George Washington, who apparently was wearing a wooden tooth. That must have been ugly and awful and uncomfortable. But the point is, we can replace them. It costs money, and it's stupid to go there if you don't have to, but you can replace them. But here's what my question is. While you're losing the teeth, which may take anything between 2, 5, and more years to get to that point of losing them, right? Don't you have an infection in your mouth during this time? A flesh-eating infection? That's probably not a clinical term, but it's, that's what it does. It eats your flesh, it eats your bones, your gums, it stinks, it's rotten stuff in it, it's that ugly yellow, orange pus you have in it, right in your mouth, right at the gateway of your blood vessels. It goes into the blood like no tomorrow. In fact, if you eat food, that gorgeous steak, that beautiful salad, it makes sure it cleans out that infection, takes it in, puts it in the stomach, and gets going from there also. So you're poisoning your body every minute. Now, that means you're killing your kidney, you're killing your liver, you're killing your stomach, you're poisoning your blood. Ladies have babies which get premature born if they have dental gum disease. In California, there was even one lady who had a stillborn baby. Now, grant you, that's only one case, but if bad things like that can happen, premature babies and all that thing. Then what about the everyday flu? What about the immune system, which is kind of like dragging this whole thing down? And as I said, slowly killing the liver. You can't replace your liver the same way you can replace teeth. So wouldn't be, my point here, I know I'm dragging this on, but my point here is, wouldn't be the actual gum disease being much more devastating than in the end the loss of tooth?
Now, there is a difference. There's gingivitis, which a lot of times can become what's called periodontitis.
I got that. I got that. I don't want to, I just say, if you let it come to a gum disease, if you let it come, which starts slowly, called gingivitis, goes a little further, you eat away, you have an infection in your mouth, is it poisoning your body or not? That's all I want to know.
Well, once you get to periodontitis, which is the stage past the gum disease, in order to get to periodontitis, a lot of people do start off with gingivitis. And that at that stage of periodontitis, that's where the support around the tooth, meaning the gums and the bone, they are diseased. They begin to decrease in the amount and in the value of it. That disease process does affect other areas of your body. Some of them are not proven, so I wouldn't go as far as to say certain things are proven. For instance, periodontitis will automatically cause liver problems. But I will say that having periodontitis will cause you to have other problems in your body due to the bacteria that is in your mouth that is multiplying exponentially, and especially if it's unmanaged and it's going into the bloodstream or going into the digestive tract. The periodontitis, some people have it as an inherited problem. And so there's a thing called, for instance, juvenile periodontitis, where a child will have it. Or patients that suffer from diabetes, they may have more of a chance to get periodontitis than the patient without. So there is definitely a reason to have your gums treated and your teeth treated on a regular basis and maintained by you at home in order to prevent periodontitis or to prevent the problems precipitating from it.
Right. So because, I mean, if a person has an ingrown toenail and it's all, it's all open wounded, or has a little wound in the size of a penny for that much on his hand, and it wouldn't go away for a week or so, he would run to a doctor, wouldn't he?
Right. Most of them, yes.
And you have it in the mouth. I have heard it's as big as your hand. You know? And people don't. The fact is, if you have an infection, by definition, an infection infects other parts of the body. And it makes you tired. It makes you exhausted. It's like all the health soldiers, whatever they are, they have to fight this infection. And then when there's something else coming, there's no more soldiers.
The body is overloaded. Right. Then
Yeah.
the body becomes overloaded and our immune system becomes challenged to handle the diseases of the mouth and whatever else is going on. And if the patient has other compromising diseases such as diabetes or such as certain bone diseases like osteoporosis or problems in their health other than their mouth, then that makes everything that much more challenged. A lot of times I'll tell patients things in your mouth that cause problems can be prevented probably faster than the things in the other areas of your body because you have more control over what goes in your mouth. You have more control over how you clean your mouth and the amount of time you give to your cleaning. But if you have certain diseases that are inherited, then it may be a little less controlled by you. You may have a disease like sickle cell anemia, and that may not be as well controlled by you. So the patient has to understand that the priority of their health over other things. Many patients may put certain things ahead, like, for instance, they may go to Christmas shopping instead of getting their teeth taken care of. And they'll be in that pain, they'll have swelling. Some patients have swelling that will extend all the way under to their throat area. Once it extends there, that becomes a problem, especially if they're sleeping and the swelling continues on. That becomes a problem that's literally life or death. Some patients have problems that extend with the swelling that involves the eye, or that will be an internal swelling inside the sinuses of the head and the brain. Like, for instance, a few years back, a young child of teenage, adolescent age on the East Coast had a toothache, and the parent couldn't get the child to the dentist in time. And once the child got to the hospital, a surgery or so was done on the brain in order to relieve the pressure, and the child still passed away. The child still died. And so something like, especially in this country, something like tooth decay or your dental health, a lot of things as far as the education that we should and we provide at dentists can help prevent all of those precipitated problems.
Right. Well, you said it well. So anyway, the story is short. You have an infection in your mouth. It will affect body parts so badly, and you don't even know it. So all of a sudden, you start going to the doctor, trying to fix all kinds of illnesses and symptoms, and really they originate because you have a chronic, continuous infection in your body right at the gateway of your blood vessels. It's not a good thing. Thank you very much. Again, very informative, Dr. Jackson. I appreciate it. Bye-bye.
Bye-bye.